Hello, I'm Laura Cooley. I'm the editor-in-chief for the Journal of Patient Experience, and I'm joined today by Dr. John Halamka, who is with the Mayo Clinic platform as the president. And I can't wait to talk more with you, Dr. Halamka, about technology, artificial intelligence, and the intersections with patient experience, which is what brings us together. And many people may know of you. I've been following some of your work, and I know you've been working to improve healthcare through technology and data for many years. And before we dive into all of that, tell me what you'd be willing to share about you as a person before we start talk about ideas around technology and maybe something that brings you energy.
Well, sure. Well, again, look forward to this dialogue. I'm 62. And so ask yourself, in all of our stages of life, each of us have different goals, a different currency, we'll call it. Academic promotion or publication, buying a house, having a family. Everyone's approach is different. And in my 60s, my approach is to make a difference. Can I mentor those who will replace me? Can I ensure that the ideas that you and I are going to talk about go forward without me? And so I happen to, by day, run a large animal sanctuary,
Mm.
which is a community benefit, which will go on without me. And the hope, as you said, with Mayo Clinic and so much of what we're doing with data, there are decades of work to follow. And now we need to train those who will replace us to do that work.
I'm really interested in concepts around patient-centered artificial intelligence. So I'd like to just dive in right there. What would you say about how artificial intelligence and technology can really be leveraged to enhance patient experience, particularly when we talk about personalization and accessibility?
Well, I always like to talk about use cases, that is, real patients. And you may know that I have no privacy. My wife has no privacy. My family has no privacy by design. We've actually signed consents
Hmm.
releasing our privacy. In December of 2011, my wife was diagnosed with stage 3A breast cancer. It was metastatic to her left armpit. We went to a well-known hospital on the East Coast and said, well, my wife at that time, 50-year-old Korean female artist, cares a lot about her hands and making sure she can feel a brush and continue to create. So do you have any cancer protocols for Korean women who are artists? We have protocols for women. Okay. Well, so what did I do back then? This was 2011, was given my CIO role and access to de-identified aggregate data. I was able to look at cohorts of thousands of Asian women treated for breast
Hmm.
cancer and look at outcomes, side effects, what treatments seem to be most beneficial. After that, we went back to the team and said, we're going to reduce her chemotherapy dose by half. And they said, well, that might not lead cure. I said, well, but then again, it may wildly reduce her side effects and meet her goals. And of course, she's doing very well today.
Hmm.
She's now, clearly cancer free after 13 years and has full use of her hands,
Hmm.
runs the animal sanctuary. So I tell you that story because wouldn't we want predictive AI, which is just math, not magic, to look at millions of patient journeys and say, oh, for the patient in front of you now and their care preferences, this journey is likely to meet their needs. It shouldn't be a CIO doing a one off analysis. It should be every patient that has access to that.
Hmm. I love your personal story. Thank you. And I'm so glad that your partner is in good health today. One of the things your story brings up for me is that I wish we all were experts in healthcare and could advocate for our loved ones. And that's not the case for the majority of the population. So I'm really grateful that people like yourself are out there advocating in that way to really drive what can be possible with technology and personalization. And we often hear people talking about things like real-time solutions, and what does that even mean? But one of the things I'd like to learn from you is And what do you see as the possibilities with AI providing real-time solutions for everyday concerns of patients, like scheduling and communication and addressing social determinants of health, which is a huge ballpark. What thoughts do you have about that?
Well, I mean, again, so many opportunities here. So as we proceed with predictive AI, and we can talk about generative AI in a minute, we want to make sure that that AI is going to be fair, appropriate, valid, effective, and safe for the person who asks the question. So sometimes you'll look to AI that's slightly less risk. It's not diagnostic or treatment focused. It's more workflow, as you point out. It's getting through the visit, getting the right patient to the right place at the right time for the right care, the clinician documenting that care. And so we've started to see various kinds of AI that will help with things like ambient listening. So, the patient, the doctor have a dialogue. The medical record becomes a summary of that dialogue, accurately reflecting what both parties said. Or clinicians trying to figure out who gets what referral, what test that might benefit them in what place at what time, or who could get care in the home safely with a good outcome. And so all of these kinds of algorithms already in production at Mayo. And as you suggest, so many of them are just helping us with getting the care delivered that is needed by the patients who ask for it.
Yeah, and I think there has been a lot of excitement, confusion. There's a mix of optimism and pessimism when I hear people talk about AI in healthcare. My sense from you is a sense of optimism about all the things these AI solutions can bring to us. And one of my optimistic hopes is that it will reduce complexity rather than increase it. And, I think our healthcare systems are really overwhelmed, and it's overwhelming for patients. And, I'm wondering about how we can look to technology to help simplify and streamline our patient interactions with the health system.
Well, I've been working on this for 40 years. And so you could say I'm incredibly optimistic because this may be the first time in history where the technology is good enough and there is robust amounts of privacy protected, ethically consented data. And there are policies that enable us to do the work. And there's a cultural imperative to do the work. To your point, it's getting access, right? So much of this country doesn't have the specialists that you need within a convenient driving distance. So either you're going to use an AI in your home, you're going to do telemedicine, or you're going to, because the right patient will be seen by the right specialist, access will be easier because that means the specialist will see just those people likely to be helped.
Yeah, I know I've heard you speak before about the ways that the Mayo Clinic system is supporting other entities, like using the work that you're developing. I'd love to invite you to tell us a little bit about that, what you're excited about, how you and your enterprise are able to contribute on this broader scale.
Well, absolutely. So we talk about academic health centers. Now, academic health centers have data scientists, have privacy advisory boards, have cloud computing. Well, the community hospitals of this country just don't. And then you start to go outside this country. I mean, we know rural areas very poorly represented even in the US, but you start going to Kenya, Nigeria, Pakistan, northern India, and there's just no access to the specialists or the care you need. So question to ask is, how does one deliver the algorithms that are going to be beneficial using the technology, the regulatory framework, and the cultural sensitivity of each location? And so that's what we've worked on. I've been in 21 countries so far this year. We've signed arrangements with Brazil, Canada, Singapore, South Korea, Israel, Pakistan, Nigeria, and Kenya to help curate data and to bring AI solutions into workflow in their environments. So that's, as I point out, if you're going to make a difference, 85% of the world lives in a low and middle income country. You better actually not leave them behind.
Yeah, well, I'm glad to hear that you're investing your energy and that the Mayo Clinic Enterprise is also investing in the world. I think in the conversations I have around patient experience, because I'm US based, it can be very US centric. And I think we really have to expand our thinking about the needs of humans at large and how AI and technology can improve our experiences in health and care. And one of the things that I often think about, because I work in the patient experience space, is feedback and data, and specifically, patient feedback, patient-reported outcomes, patient-reported experiences. Like, what role do you think AI can play in gathering and then analyzing some of that feedback so that we can move towards faster improvements with our delivery?
Sure. Well, three answers. So, one problem, and I'm sure you've studied this, is the social determinants of health are poorly recorded in electronic health records. A lot of that has to do with it's 3 a.m. on a Sunday, you're in abdominal pain, and somebody wants you to stratify your race ethnicity. Yeah, it's just not so good. So, one of the things we've done is built a model which looks at every address in the United States. And based on latitude and longitude of every address in the country, looks at where are the Superfund sites, where you've got air, land, water pollution. Where's the nearest grocery store? What's the access to primary care, crime, education? Are there climate change issues, right? And so we actually add 40 variables to every patient record based on a model forecasting what they're experiencing at their address. So that's sort of one thing. But also, I think it's really important, as you point out, that patient source data, which could take maybe two kinds. Some people carry devices or wear devices, and that device data tells us a bit about your activity, could tell us something about your heart rate, could tell us something about your mental status. How many Facebook likes did you do today versus yesterday? And so that's more of the sort of objective data, but the subjective data, my father had multiple sclerosis for 23 years before he passed away. And really key is to understand, how do you feel? What is your pain? What is your fatigue? Are you feeling side effects of the medication? Can't get that any other way but patient report. And so that's the kind of thing where we talk about generative AI, being able to read large amounts of incoming text and then create structured summaries.
And I'm glad that you pointed that out, because I think that the movement around patient experience and the measurements that we've been using often rely on survey data. And that data are looking at the experiences we have when we encounter the health system, when we encounter our doctors, our nurses, the healthcare team, our scheduling and accessible elements. And at the same time, I think we must look at the actual health and like feeling that is being reported from our patients. So I think that there's a lot of opportunity with AI in terms of looking at that. You said something I want to be sure that our audience understands, and I need to understand too. What is the difference between generative and predictive AI, and why should we care in terms of patient experience?
Well, I've got a book coming out on that topic.
Okay, good.
But generally this, think of predictive AI as just an extension of the math we've been doing for 50 years. And that is, it's taking a set of inputs, well-defined, and then based on mathematical models, creating a prediction. And we can test that prediction against ground truth. Did you have the disease or not in the end? So the great thing about predictive AI is the model tends to perform consistently and predictably. And you're going to be able to grade it as good enough or not. Here's the generative AI issue. The generative AI issue has wildly many more inputs. It isn't just, oh, I'm going to take your age and gender and diagnosis and maybe some laboratory data. No, generative AI, I'm going to go read the world's literature. I'm going to go read 3,000 pages of your medical record. And then the notion of language models is to say, oh, Well, based on our reading that large corpus of information, I will respond to a prompt and attempt to create a summary statement. Problem with it, it's great in many ways. I'm sure you've used it.
Oh, yeah.
But, right, because it is coming up with a different response every time you prompt it, some responses may be excellent and some may be fabrication. And so I think our issue, it'll get better, and there's better training going. Mayo's got 8 projects of training large language models with Mayo curated data and literature and that kind of thing. But for the moment, I think we're all a little reluctant to use generative AI in a patient-facing capacity. We will use it in maybe a technique called retrieval augmented generation. Go out, here's an article written for a medical professional. Can you summarize it for a layperson? That you can probably trust, right? Because it's not using its training data, it's just summarizing an article that is of known credibility. But I think at the moment we're all saying human nearby, interpreting the result of the generative AI and then sharing it with a patient at the moment.
Yeah, well, thank you for adding that clarity. And I know that conversation is going to continue to advance. So what you might answer to that in a year will be interesting. We'll see the comparison. And that idea of like, what can we trust when it comes to either predictive or generative AI, leads me to a question around decision support. I am also optimistic about how AI and machine learning can improve or really partner with clinicians around decision making in the clinical space. Like, what do you see in terms of ways AI, machine learning is helping providers with their decision making in the clinical context, and maybe opening some space for personal connection with patients?
Sure. So I went to medical school in the 1980s. And do you know a few things have changed since then?
I
But
hope so.
what I tell people is 50% of what I was taught in medical school is wrong. I just don't know which 50%.
Mm.
And by the way, in my field of emergency medicine, 800 papers are published every day. And I'm slightly behind on my reading. So what you would hope is to say, oh, well, I might not be able to read 800 papers a day, but generative AI can read 800 papers a day. I'm not able to read every paper and textbook and updated protocol and figure out what was right and wrong in my emergency medicine education. But predictive AI can look at the millions of patients that have come through Mayo Clinic and other places in the world and say, this drug seemed to work. This diagnosis seemed to be right. So I think of both predictive and generative AI are augmenting, as you say, human decision making based on evidence, because we can't rely on what we learned 40 years ago.
Yeah, or even 4 years ago, right? With 800 papers a day coming out, which makes me unsure about whether I should keep publishing papers, Dr. Halamka, but I'll stay in that business for now. I love the idea that AI is supporting humans and allowing for more connection. And another hope I have, and we'll move towards a wrap up with this, is that by using it as a support mechanism to augment what we know, and what we do, it can help our clinicians. We're often talking about clinician burnout and how we can support clinician wellness. Like, how do you see AI-driven solutions helping to reduce administrative burdens, to support our clinicians to deliver care more, not just more efficiently, but also like more humanistically?
Well, as you said, I have served multiple presidents. And let me just give you a very brief description of the journey that got us to where we are today. So when you look at these multiple presidential administrations, they said, we need to digitize healthcare. I mean, it's one of the last industries that's paper-based. We need to be able to do analytics and measurement and all the rest. And we said, great. So in my role, running the Health Information Technology Standards Panel and its successor, the Standards Committee, I went to the FDA. And FDA said, well, we really want to monitor devices and drugs. And here are the data elements we need. Oh, that sounds great. Then I went to CMS, and CMS said, we want to measure quality. And here are the 40 quality measures that we need. Then I went to CDC, and CDC said, oh, biosurveillance. We want to look for the next outbreak. Well, by the time you got all of the requirements for all the data elements, which were all good individually. There were 140 data elements to be entered at every encounter by every physician for every patient. So I have 11 minutes to see you, make wonderful empathetic decisions, and enter 140 pieces of data. It's not possible.
No.
And so what you hope is that you and I have this dialogue. And then AI is able to take this patient-centric dialogue and fill in at least the bulk of those 140 data elements so that all I have to do is review it. And suddenly, not only am I spending more time looking at you instead of a keyboard, maybe I'll even get home to dinner with my family. And these are unfortunately the things in digitizing healthcare thus far is we've taken from our clinicians and not given anything back, and AI has the potential to give something back.
Yeah, and I see glimmers of hope that we are shifting in the right direction as it comes to that. And of course, we have a lot ahead of us in terms of helping that shift happen. Well, I am so delighted to have learned with you today. And as we wrap up our conversation, I wonder what final thought you might have. Like, what do you hope people walk away thinking about when it comes to patient experience and these intersections with AI and technologies?
Well, so important to recognize none of us can do this alone. And so form coalitions, bring together partnerships and collaborations. My role over these last couple of decades has been trying to seed a dialogue, bringing together government, academia, industry, patients, providers, payers, pharma, and working together to solve these challenges, because each of us will have a different set of needs and perspectives. And Coalition for Health AI, which you'll find at chai.org, is a nonprofit of now 3,000 organizations working together on the topics we've discussed and freely publishing the best practices for everyone to use. That's the kind of community we need to build.
Well, I love that you said that. As we started this conversation, I mentioned that we were brought together because of the 2024 Patient Experience Symposium. And the theme of that symposium is around planting seeds, nurturing progress for patient experience. But it's not about the seeds we plant, it's about the soil that we're cultivating. And I think what you just said is a perfect example of the ecosystem of health and care that we must nurture in order to get where we want to go. So thank you so much for this thoughtful conversation, and I hope to meet you in person one day.
Well, it's a small world, and so I am certain we will be working together.
Thank you. Okay, have a great day.
Thank you.
Bye.